Hi guys, this is Dr. Denny Warren with Generations Health and Wellness Center. And one thing I wanted to do is I wanted to address, should kids get their spine evaluated and should kids get adjusted by chiropractors? And of course my response to this is an absolute yes, they absolutely should. And here's the reason why. Because if we have traumas that happen to our body, traumas that happen specifically to our spine, and those traumas are not allowed to heal properly, then what that does is that will lead to severe arthritis and degeneration in years to come. So really, I believe in moving people towards wellness, keeping their spine, keeping their nervous system healthy, because you need your spine and nervous system to be healthy for your entire life, from birth until death. So if your spine is rotting and degenerating and decaying because you've had serious traumas that didn't heal properly, then your quality of life and your quantity of life is going to decrease. So let me give you an example. I'm going to flip this camera around here to show you what I'm talking about. So if you look at this right here, this is a model, an example of what we want to see in our spine. This one over here is an example of a normal or healthy segment of the spine. Now, if there's some type of trauma, that trauma could be a sports injury, could be a motor vehicle accident, could be a slip or fall. That trauma could be something small, like sitting with poor posture, having your head down, playing video games all the time, texting all the time. That's something we see kids do every single day. That is small traumas to their spine every single day. That can, over time, lead to degeneration in the spine where they actually have bone spurs and arthritis in their spine. Now, people think that this arthritis is just due to old age. I have a patient that's 12 years old that's right here that has all of these bone spurs. Those sharp points that you see in the front, those are bone spurs. So I have a 12-year-old, I have a 14-year-old that's right here. But I also have a 92-year-old, which is all the way over here. The 92-year-old, when we took x-rays of her spine, she wasn't taking any medication. When you took x-rays of her spine, she actually had normal curves, normal alignment, normal structure and function of the spine. Whereas with the 14-year-old and the 12-year-old, they had severe misalignments in their spine that was leading to their spine collapsing and degenerating with all the bone spurs and all the arthritis. So when you think about bone spurs and arthritis, that leads to sharp shearing joint pain, that leads to achiness, that leads to stiffness in the morning every time you wake up. That also leads to a depleted energy and depleted health and vitality. So we believe in getting the entire family checked, evaluated, and taken care of for the rest of their life, because there's going to be times in your life where you have traumas. There's going to be times in your life when you lift something awkwardly. There's going to be times in your life where you just sit for hours in front of the computer, which is what our modern day life is all about, is being in front of the computer, in front of the TV. So there's poor postures, there's things that happen to your spine, and all those things are like sugar to your teeth. So we get our teeth checked on a regular basis. We should also have our spine evaluated and checked on a regular basis to keep your spine healthy for the rest of your life. So I hope this helps. If you have any other questions, please, you can always call. I'm always available. You can always call and let us know, or you can call and talk to us here at the office. Have a great day, and we'll see you in the next video.